where whanau awhina Plunket aims to share. Oops, now I'm live. Oh, I started too early. Okay, no mai haere mai. Kia koutou katoa. Welcome to our live chat today, where whanau awhina Plunket aims to share some practical parenting information. In today's episode, we'll be talking about childhood immunisations. Over the past weeks, with all the alert level changes and the COVID-19, one of the most common questions that we are asked through Plunket Line is, what about the childhood immunisations? Should we go and get these done on the schedule? So to address these frequently asked questions, we thought
Okay, kia ora, Kelly, and thank you very much for the invite. It's great to be here. So I'm Bernadette Heafy. I'm currently the Program Manager for Education at the Immunisation Advisory Centre, who we fondly refer to as IMAC. I've worked in immunisation all of my nursing career. So from the day I got my registration, I've been vaccinating our young people, our older people, and everyone in between. It's something I feel very passionate about, and I look forward to the opportunity to have a discussion with Kelly and also to address some of your questions. So thank you very much.
Thank you for that introduction, Bernadette. That was brilliant. Thank you to everyone that is tuning in today. We invite you to come and join our live chat and just get in the comments with some questions. Bernadette will be able to answer any questions that you've got around the childhood immunisation schedule that we have in New Zealand. But let's just start off with, what is immunisation, Bernadette?
Immunisation is a brilliant opportunity to allow ourselves to become immune to diseases without the need to get sick. Now, I know for some people that all seems a little bit far out there, and how does that work? But we have this beautiful immune system, which when we're born is pretty naive. It's not been exposed to anything in the outside world. And from the time we take our first breath, we need to have that immune system up and functioning. And by having our vaccines, starting on the national schedule at 6 weeks, what we're doing is preparing and priming the immune system to be able to respond in case they come in contact with the diseases that we're trying to prevent. So while people have concerns around that, actually what we're doing is taking advantage of a natural system within our body and avoiding the risk of getting sick with the disease itself. So really important.
Yeah, so getting your child immunised, obviously there's a schedule. Is it important to stick to that schedule, and why would we be, I don't even know what I'm trying to ask. And it's important to stick to those times, because some people are unwell and they're told to come back, and then people will ring up and say that they're, a bit worried because they've had to push it out a week or two.
Yeah. So we'd always recommend on-time immunisation. The schedule is designed around providing protection when it is most needed. So when we're particularly vulnerable, if we think about something such as pertussis, which is also known as whooping cough, that's a disease that can have a profound effect, particularly on our young people, especially on infants, because they're so small and so tiny with those little airways. And it's really important to have those immunisations on time so that they're protected as soon as they can be. Now, our immunisation schedule in New Zealand generally starts at 6 weeks, and then you have a further dose 3 months, and then again at 5 months, and then there's 12 months, 15 months, 4 years. But I'd also just sort of like to put a little push here or a plug here around pregnancy IMS, because vaccinating during pregnancy is a really good opportunity for mum to be able to provide protection to the baby. And that in particular is around whooping cough. So mum receives the vaccine, her body responds to the vaccine, and she produces antibodies which transfer across the placenta. So it's like her gift to her baby to help protect them before they've got all of their protection on board from when they start their immunisation schedule. So there's also another vaccine, two other vaccines at the moment that are, recommended during pregnancy. The other one is the influenza vaccine, and that's also particularly to help protect mum because she's at greater risk of influenza complications while she's pregnant. And of course, there's the COVID vaccine as well, but you're having another webinar chat, I believe, on that particular issue. But just to, to put it out there that it's also an important vaccination to consider having during pregnancy. So on time, very important. The schedule is designed to get protection in as quickly as it can be and for when people are most vulnerable. Just like to probably mention here that you might have gone, Bernadette said there was a vaccine at 12 months. What's that all about? It didn't used to be there. When I look at my child's Plunket book, it's not in there. Last year, and the last 2 years are all getting very confused in my head with everything that's been happening. But last year there was a change to the schedule. So we actually brought in a 12-month immunisation event. And at that 12-month immunisation event, babies are offered their booster dose of pneumococcal, but also their first dose of measles, mumps and rubella. And that's around getting that, particularly that measles protection on board. And so they have the second dose at 15 months. So there's not a routine dose at 4 years now. But for some children, they won't have had their 2 doses, so they'll still get a dose at 4 years. So
awesome.
It can be hard to keep up with all the schedule changes.
Yeah, absolutely. Now, we've got more people joining in the live chat, so I just wanted to remind you all that we're discussing childhood immunisation schedule today with Bernadette Heafy from IMAC. So get your questions in because she's here. She can answer those. In terms of the vaccinations that pregnant mums can get, is there a cost attached to this?
No, that is generally one of the greatest things about our immunisation schedule in New Zealand. So vaccines that are on the national immunisation schedule are for people under the age of 18, under 18 are free, and for the vaccines during pregnancy are freely available for women who are New Zealand residents or citizens. So, and are almost just generally part of that routine pregnancy care, but they are not often offered by your midwife. You'd have to access a general practice or for those vaccines.
Another question that comes through our phones often is with pregnant mums just wanting to know if they can be talking to their family about getting maybe a booster of that pertussis whooping cough just to protect this pepe in those early stages.
Yeah, certainly we also get that question a lot too on our phone line as well. And I mean, the most important protection for baby is the protection that mum can offer through her having the vaccine. There is extended protection by having those who are around the baby vaccinated, which is why we encourage health professionals who work with babies and young children to ensure that they're vaccinated against whooping cough. In terms of grandparents, dads, other people who live in the household, they don't have to have a vaccine every time there's a new baby though. So mum has a vaccine each time she's pregnant, but for the family, it's around that every 10 years or so. So depending on how long you've got new babies in the household for. So,
excellent. Just jumping back to another question.
Sure.
When families are going in for their immunisations with their pepe, are they welcome to bring extended family members, some support people with them? Because sometimes it can be overwhelming, particularly for new mums and dads in those first few months.
I totally agree. The thought of going in for a vaccine, for, baby's first visit to the general practice, all of those things, yes. I think at the moment, in terms of bringing additional people in with you, it's going to depend on things like the COVID alert levels in your area. And there are, I would always encourage people to bring a support person along if they feel like that they need that, whether that's nanny or auntie or your partner. Sometimes you have to bring your other children as well, and that can make it all seem a little bit overwhelming. But it's around just, having the support there that you do need. And if you're worried or concerned that there might not be, enough space, ring and have a chat with the practice nurse. Also, just check what the current guidelines are around in terms of what's happening with COVID in your community, because we want to keep everybody safe. So,
absolutely. Yeah. So is this safe for my child? This is another quick question that keeps coming through into Plunket line. And I guess that just comes again, particularly new parents wanting to do the best by their new pepe that they've got.
Okay. I guess from the framework I come from, vaccines are the safest way for us to provide protection for your baby, for yourself against these diseases. I think what's really hard for some people is that we don't see the diseases. So the diseases don't feel that real. We don't feel like the risk is right there. At the moment, we feel like the risk is here with COVID. And so, there's that drive to get protected. Most of the time when our borders are open, everything's only a plane flight away. And we certainly saw that in 2019 and in early 2020 with the measles. Bringing measles into New Zealand, and then it's spreading within our communities.
Excellent. Are you able to just talk about when's the best, when should our pepe or tamariki be having a flu injection? I know it's not on the, but we do get some people ringing up saying, should I get my baby done? Is it too early? Do I wait until they're at school? And so, just some talk around that.
Excellent. So influenza is a respiratory illness. It mostly circulates during the winter seasons. And so we generally start our vaccination program from around the 1st of April. It sort of does vary a little bit. The vaccine is available for anyone from the age of 6 months upwards. Now, there are some children who are funded for influenza vaccine because they're considered to be at greater risk of the complications. So children who have diabetes or asthma, there are some neurological conditions, there are cardiac conditions where those people, unfortunately, if they get the disease, are more likely to become unwell. So we'd certainly recommend that if you've got those concerns or your child has a chronic condition, that it is certainly worth checking out whether or not they're eligible for the vaccine. In saying that, children who are in daycare, children who are at school, we can all pass on respiratory illnesses. And I think it is important to consider influenza protection for all children. And I guess this is also where you can look at things a little bit in the reverse. So grandparents having a pertussis vaccine to help protect the infant, actually young children having an influenza vaccine will potentially also help protect our elderly. So unfortunately, it's not funded quite on that level. But I'd certainly recommend all parents consider influenza vaccine for their children.
Excellent. Oh, thank you for that. Going back to the schedule. Sorry, yes. I'm just jumping around. Come on, people, get your questions in. I'm reading your questions. So don't be shy, get them in so I can ask them. Just going back to the schedule, how would I know when the next vaccine is due for my child?
For the most part, you'll get a communication from your primary healthcare provider. Now, I know that in parts of New Zealand, it is not that easy to get enrolled in a GP service, and sometimes it's just not possible to get your child into a general practice. So there might be outreach immunisation services in your area as well. So generally you'll receive a text message, maybe even an old-fashioned snail mail letter, you never know. Do check the mailbox occasionally. Or you might get a reminder in a patient information portal, so something like Manage My Health. But it's also worth checking with your tamariki well child provider. Is my child due for any immunisations? Certainly your Plunket nurses will be able to advise about when they're due. Check in the well child book. Or you can just ring and ask. Something we do encourage to be done, like when you've been in and you've had those 6-week IMS, is actually looking at making your appointment for the 3-month IMS while you're there. That way you've got an appointment, it's in the calendar, you can change it if necessary, but you know when the next goalpost is. So it's worth looking at that. I know our lives are hectic.
Yeah.
So sometimes just booking it in ahead of time is actually a good thing.
Yeah. Oh, good.
Yeah.
So what is whanau going to expect when they come in with their new pepe and they're going in for the very first immunisation with the registered nurse?
Well, if they encounter me, they'll find a very excited registered nurse who just loves seeing those tiny little fingers and toes. And, hopefully what you experience is a friendly, welcoming atmosphere. The opportunity to ask questions. You'll be asked some questions. You'll possibly have to enroll your baby at the general practice, sign some forms, but then, go through, have a conversation with the nurse around what is it that's going to happen today. Ask any questions that you've got. You should be able to ask, even if you think it's silly, ask the question. That's, we're there to answer those questions. They'll check that everything's appropriate for your child to have the immunisations. They will talk you through what they are vaccinating your baby against. How many injections are there? Is there anything given orally? Those sorts of things, and what to expect afterwards. Now, in terms of, they'll explain that their little legs might be a bit sore, they might be a bit red, they might feel a bit hot. They'll also go through things like, what can I do to make my baby comfortable afterwards? I encourage mums to breastfeed while we're vaccinating, before, during, after, whatever they're comfortable with. It's a great way to comfort baby. It's also a comfort for mum as well, having that connection. I think, for some parents, the thought of needles and injections is a very scary thing. And the thought of them, your baby having injections can feel like a very scary thing. If you are particularly concerned around the needle aspect, it may be possible for someone else to hold your baby if you don't want to be in the room. Bring a support person along. But yeah, I just think the most important thing is that we give you the opportunity to ask your questions, and that you feel comfortable with the decision that you're making around providing the best protection for your baby.
Awesome. Thank you. So again, just repeating the topic we've got here today, childhood immunisation schedule, and we have Bernadette Heafy here from IMAC. Please come in with any questions that you have. I really tautoko your kōrero around, encouraging mums to, feed their baby or cuddle their baby, or having someone else, a support person that can do it if the whānau aren't wanting to hold them and are a bit worried about the needles. So I think that's a fantastic, just fantastic for the registered nurse to be able to offer that.
Yes.
It can be very, very scary. A question has come in. Yay, thanks team for getting in your questions. What should I do if my baby is feeling unwell on vaccination day? Should I reschedule?
Okay, I think in general, unless your baby has a high temperature, then normally we would go ahead with immunisation for little things like sniffles and colds, which, are more frequent at this time of year. That it's important, if your baby is too unwell to be vaccinated, that assessment will occur prior to them being vaccinated, and then we'll arrange for you to reschedule. So I think it is important to still bring them in, get them checked over, and if needed, we'll get you to come back another day. But it's really for them to be too unwell to be vaccinated, they actually need to be quite unwell. And high fever and acutely unwell, rather than just a little bit of a sniffle, which are quite common at the moment. And if they're getting over an ear infection, or they're still on antibiotics or something like that, then generally they are still well enough to be vaccinated. So we'd certainly encourage you to keep those appointments and come in on time. Yeah.
Excellent. What if a family was struggling to get an appointment in, excuse me, and they were late for the immunisations? Where could they contact for some help there?
The best place to start with is your primary healthcare provider. Also, have a chat with your Plunket nurse. It's never too late to catch up. So even if you're like, oh gosh, it's been a month, I forgot, life got busy, I've been in level 4 or level 3 alert levels, and it's just all been too much, and I've forgotten. I've had the kids at home and all those sorts of things. It's never too late to catch up. So have a chat with your general practice, have a chat with your Plunket nurse, and if it's also about it's too hard to actually get into the general practice, then they'll be able to talk to you about other options that are available. So there are backup systems available around outreach immunisation services, so people coming to the home. But it's also important to stay engaged with your primary healthcare provider. But have a chat with your Plunket nurse, with your primary healthcare team, and they'll be able to point you in the right direction or do a referral for you.
Brilliant. That sounds great. Now, also, you can go on to the immune.org.nz, which is running along the bottom, to speak to anyone or have some resources that you might want or information about immunisations. Also, if you're wanting to, you can ring the Plunket line, 0800 933 922. You will speak to a registered nurse on the phone, and she will also be able to give you some information. Maybe you're just wanting to know where you can go and get these immunisations done, or if you're new to a new area, absolutely. The Plunket nurse on the line there can engage you with immunisation, holder service, medical centre where you are. Now,
I totally support that, Kelly. Talking to your Plunket nurse is really important, and ringing Plunket line. If your query's complicated or you've got questions, Plunket and ourselves have a very good relationship, and we're very good at working together to try and find solutions for people and answers. So, yeah.
Yeah. Oh, good. Yay, we've got another question. Thank you, Skylar. Why is it important to get my baby immunised? So that's a good key question to have for you, Bernadette, having you here from IMAC.
Okay, it is a good question. And I think in terms of going back to what I said earlier around when we're born, we've never been exposed to any of the diseases. Our immune system is up and ready to go. It's waiting for all of the things that are out there in the real world. By having vaccines, you're getting, potentially, you're getting a protein or an antigen. So it looks like, it feels like to the body, like part of the virus or the bacteria. So the immune system goes, oh, that doesn't belong here. I need to do something about it. So it produces an immune response, and it produces antibodies. And as you generally have more than one dose, you get memory cells. And then through that vaccination process, through that immunisation process, if you then come in contact with the real disease, or what I call a wild disease, it's out there running wild, your body's primed to respond. So while no vaccines are 100%, and some people will still get the disease, in general, you will get lesser disease with lesser side effects and lesser complications if you've had the vaccines that have prepared your immune system in advance. So the other thing I'd add to that is also in terms of with baby, a lot of the diseases, you're at greater risk when you're very young and very small, which is why we start the immunisation schedule at 6 weeks, is so that protection is on board when you're at greater risk.
In terms of the premature babies that are coming, so you might have a baby that's born 32 weeks. So they've got their age where they're born and they've got their age corrected. What age are you going to for those immunisations to start?
So it's from their date of birth. So if they're born at 32 weeks, they are offered their first lot of immunisations when they would have been 38 weeks. So 6 weeks from when they are born, rather than adjusting for what should have been their gestational age. So, yeah. Which, I mean, I think there's, those babies can often be very tiny, and that's a decision that's made in conjunction with the specialists and the nurses in the hospital around when is a good time to vaccinate them. I think the thing to remember with those babies is they haven't had that last bit of opportunity to mature. During, they've missed that last part of pregnancy, they've missed some of the antibody transfer from mum. So actually vaccinating them when they are 6 weeks old is actually really important to help get them protected.
Excellent. So we're just nearly about to wrap up. So I thought I'd do last calls for another question. Thank you again to Heidi and Skylar for their questions. And thank you to you, Bernadette, for just informing us of all this brilliant information you have in your role where you're at.
Thank you.
So yeah, as we're winding up, just a few key places. So where would you be asking a mum or whanau to go if they had any questions about childhood immunisations, either before they have their pepe or after they've had their pepe?
I think there's a number of places you can go to. I discuss with your trusted health professional, whether that's, midwife, Plunket nurse, practice nurse, your GP, might be the local pharmacist. The Ministry of Health website has really good information around immunisation. It has some brilliant short videos to try and explain some of the concepts around immunisation and how it works. And if you're looking for more sort of technical information and advice, you can use the IMAC website, immune.org.nz. You can ring Healthline, ring Plunket line. I think, really important to use those trusted places for information. Yeah,
absolutely. And are people able to access information in different languages? If we could have some in Te Reo or some of the Pacific languages, some of the Asian languages?
Yes, there certainly is, in terms of when you're going and you're being given information from your healthcare provider, especially for important things like the post-vaccination information. There are options around different languages. Sometimes they don't come in the same pretty tear-off sheet, and it might be something that's printed out from the computer, but there are different options available. And the Ministry of Health website does have some of those available on the website. So if you go to health.govt.nz and put in immunisation, you'll find information there. Also, if you are looking or have got concerns that you won't understand the information from your health professional, let them know that so that they can organise interpreting services when you are going for your appointments, because it is really important that you do understand, you do have the opportunity to ask questions. So, just making that need known ahead of time can make things a lot easier for both sides.
Oh, that's brilliant. Thank you so much for that. Thank you for your time today. No more questions coming through, but I just again wanted to just thank you for coming in, bringing your expertise to us, answering some questions about the childhood immunisation schedule. Very topical at the moment, considering the environment that we're in. And it's just a really great platform for people to be able to see where they can go for information, so they can make informed decisions for their whanau. So
Absolutely.
Thank you so much for coming on today. Unfortunately, this is coming towards the end of our live chat, but you can also contact immune.org.nz to find out some useful information or ask any questions. You can contact Plunket line on 0800 933 922. Talk to your well child tamariki or nurse at your visit in the home, and just, get those supports in place so you can make a good decision for you and your whanau. So we'll just wrap this up. You're all good there, Bernadette?
Thank you. Thank you for having me. Pleasure.
Oh, thank you so much for coming in. So we are going to have another live chat on the 14th of October, and that's going to be around the COVID-19 vaccination in pregnancy and, for whanau. So check back in, and we look forward to seeing you on our live then. And thanks again, Bernadette, for coming in. Ngā mihi nui. Thank you for supporting whanau Awhina Plunket in our live chat today.
Thank you. Ka kite.
Ka kite anō.